Aren't you?
Okay,
Yeah,
roll call
okay. Clarence Campbell,
here.
Dr. Horning,
Here.
Laura Cruz. Here. Laura Negro. Laura Negro. Dr. Keller,
Here.
George Busse.
Here.
Richard Huber,
Here.
Matt McKenzie.
Here.
Joy Henderson. Here.
Okay, next item is the approval of the minutes of the last meeting. Anyone care to make a motion?
I move to approve the meeting, the minutes.
Oh, second.
Any additions or corrections to the minutes? Otherwise, all those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Public comments. Anyone from the public wishing to make any comments? Being none, we'll move on to 2023 year-to-date expenditures.
So that should be in the packet.
You're-
A little bit of our conversations that kind of ended like this and the next two are on agenda items. But for, okay, get that shaded up there. So overall, right now, I mean, we're only halfway through the year, so we're, looking pretty good. We're at 52% overall of our expenses. This is through July. And, compared to last year, we were at 53%, so what we had budgeted, so we're right on track with that, and then, there's some, we're still using up our grant, so we haven't, we are starting to use our levy, but get it in there, so the next meeting will, we get more into that, but, that's the same every year. One of the big things that I wanted to touch on is, for children's and family we're gonna talk about other next agenda item too, but that is, we are at or above what we are above what we had budgeted for the year for our placements. So, we'll get into a little bit more detail. So now anything going above will just continue to come out of our levy for that. But hopefully some of our other stuff will stay under. Make up for it like last year, but does anybody have any questions or anything specific on this? No questions on that was expensive, then we'll go into the placement costs, yeah. So, they have a new one, right, Lisa? Yeah.
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 Yep. Oh, that's the first page. Go to the next page. There you go. Mhm.
Okay, so, on here you can see where we are through August. And Amber took the average monthly cost to date and then did a projection of 94,000 just on average for the remainder of the years. I have remainder of the months for this year. We always hope it will be lower. It could go up. These are the out-of-home court-ordered placements. So the ones that really drive it, I kind of did a little bit of a narrative down here for you to be able to see comparisons. So in 2022, we had 16 youth who were in a delinquent order, on a delinquent order, who were placed in residential care, which is very expensive. So you can see just those 16 youth alone cost $734,000. The only amount that we receive for that funding from the state is $216,000. So we are funding $500,000+ that the state
just expects us to without making us whole.
What would make somebody delinquent in this category?
So if they're placed in a residential, they're probably a danger to the public. So they've committed a pretty serious crime and they need pretty intensive rehabilitation. Most often there's a dual diagnosis of mental health or substance use. For kids, it's usually more mental health. And so we're treating that and the behaviors that they have. If you want to share regarding that, Jared.
Are you, just curious, Matt, are you talking about what delinquency means?
No,
Oh, okay,
I'm talking about what sort of violations are they doing to end up here?
Yeah.
So I get kind of an idea what kind of character we're talking.
it's a little bit, a lot of the kids that we're talking about are kids, it's not that they're necessarily committing specific crimes. It's that they are kind of habitually acting in criminal manner. Along with, like Terry said, that they a lot of them have mental health diagnoses. There's AODA issues either with the child or in the household. Some of the kids have some cognitive issues that go along with that. So there are multiple layers of things that need to be addressed in terms of treatment.
So then, year to date for 2023, we have 9 youth, currently at 417,000 for the delinquencies. We also have some out-of-home placements that fall under CHIPS or JIPS, which are children in need of protection or juveniles in need of protection. So that's a different category, but as you can see, that adds up as well. So we have in 2022, we had 40 youth for over $500,000. One of those youth is very young and was placed out of state. Nobody in the state would take this young person. Placed in Illinois first, and then they gave notice, and jury found placement for this person in Pennsylvania.
Mhm.
So there's just one youth alone cost almost $200,000. The good news for us is the family moved, so we are no longer responsible for those costs. Unfortunately for the county that they moved to, that county is now responsible for those costs, so it just shifted, but like I said, it's a very young person who will hopefully be able to be returned home, but he's been in placement for 2+ years now and still hasn't been deemed safe to return home.
I believe he's 10 years old now.
Oh, my God.
Yeah,
And one of the hard parts with that was we were eligible to petition for change of venue in January. But the Wisconsin Intercounty Agreement, it has, specifically talks about that change of venue. And that even after the change of venue, we still had to continue to pay that for 3 months before the new county of residents took over the payment of it. So that was painful.
yeah. So you can also see just a little summary of how much the placements cost. So the most common ones that we are using are Rawhide, which is in the Green Bay area. Depending on the level of care, it can range from $10,000 to $17,000 a month. Courage in Milwaukee, $10,000 a month. Prentice House right here, about $8,000 a month. Positive Alternatives, which is, where is that?
They have several homes, Amory and Eau Claire and River Falls.
So about 12,000 a month for that. And then included in these totals as well up here are regular foster care and treatment foster care. And those are much cheaper alternatives and they're in a home setting. So, those are obviously where we want our kids to be if they have to be placed out of home or with kinship. So a family member, close relative, that's actually the most ideal.
Mhm.
And you can see those here, the kinship placement costs. So for all these, kids that we've had, 16 children is only, it still adds up, but it's 4,800, which is less than half of what one child placed in residential would be. And kinship, they generally make us whole and pay for that, so. So we wanted to share that because that leads into the next agenda item, but any questions on this?
Can I add a little bit of bright news to that, Terry?
Oh, absolutely.
So the bright news is that we have been working diligently on finding permanents for a lot of the kids that we have in the foster setting. And we've done that through we've had two termination of parental rights cases so far this year, where those are going to be moving on to adoption. And the adoption subsidy comes directly from the state, does not come out of our budget. And we've had, I think, 3 cases go to a subsidized guardianship so far this year. And that too is money that ends up coming out of the state's budget and not our budget. So then on top of that, we have at least 1 more termination of parental rights coming up this year, and potentially 2 more subsidized guardianships. So my workers are working hard at getting these cases through to permanency, not only for the betterment of the youth, but helping our budget as well.
So for the budget, I don't know, we had our first draft that we had presented at the finance meeting a few weeks ago, so I'm not sure. Any of you saw those numbers on there. And we had a lot of discussion there about these placements and the amount of money, that to make sure we're budgeted in it. So we looked it over, and did make quite a bit of changes after more review, and then also, with a suggestion from the consultants to, remove. I did 4%, but they suggested do 3 to 5% of the wages as a deduction, or when you don't fill positions right away, so. To do that.
I couldn't hear what you said about the wages.
To take 3 to 5% of our wages and deduct them from our budget for when we don't fill positions right away. So it's a very, very trimmed budget. I'm not gonna lie, I'm a little bit nervous that, we don't, because the budget is still a budget, just kind of guessing, to be honest, with a lot of numbers, but I think we were pretty confident. We did lower, originally we had in there was I think we had $1 million under our sub-care line. I think further we would have found out that we have the youth age line, and that, so between the two, we wanted to make sure under children's that there was $1 million. So that was it. We had, we have increased that budget line by 350,000. So that's the majority. If you see the difference here in that bottom of the 589,000, that's the additional to what we asked for last year. So that's a big portion out of it is the children's placements. The other thing is the wage study with that being implemented. The total cost of that for us is actually, the difference is 400,000 for our wages, but a lot of that is able to be in the grant, so you don't see the full blunt of that being added to there. We did add 75,000 in for transports from the sheriff's department to pay them for it, but overall at the county level, so we'll have 75,000 more here, but the sheriff's department will record that as revenue. So as a whole county level, it'll be the same, but in our books, we're asking for 75,000 more for our department. And then we do have less COVID grants coming in, so about 150, 200,000 less than that. So those are the big reasons for the big overmatch. The first draft that I sent was just under 1.4 million. So after the changes that we made in the last week, we do have it down to 589, which is a big difference. So that's where we're at. We were looking for some guidance about the placements because there is unknown, but with the history that we've had the last 3 years, and where we're looking for this year, Terry and I are pretty comfortable with $1 million in that line for just the children's. But are open to any suggestions or if you guys have any other discussion on that. Or if you have questions about anything else. that we're fine.
So I think we would request a motion to approve this if you don't have any other questions.
And then this will go back to finance committee next Wednesday for their meeting.
So the huge increase here is for children and family. And we're talking just under $1 million there. Is that correct? Am I looking at this correct?
Yep, so the other thing on children's I should touch on too is with that, with Scott's Ignite grant that he's working on, that is a big chunk of change with, so it has a big chunk of revenue and expenses. So children and family, you do see a big increase in expenses, but there is also an increase in revenue for that, because that's 100% covered, so that'll match. So there is both. The main thing in children's, you'll see the cost for is 350,000 of it was for placements of that total, a little bit for wages. And the other thing I forgot to mention before is we do have more cost for court counsel that we put in there, and that was about 80,000. That's in children's and adult, so that's in both of them.
So we have an increase in revenue of about 400,000 then.
Mhm.
So we're looking at a roughly $400,000 increase for children and family.
Overall increase for just children and family is about 370. And then we already know that the 350 of it is placement. So the majority of that, for just that line item would be the placements for that children and family under that.
Well, I would make a motion to approve this.
One second.
Any other discussion? Otherwise, we have a motion by Dr. Keller, seconded by Laura Cruz to approve the budget for 2024. All in favor signify by saying aye.
Aye.
Opposed?
Aye.
If it's money, should we have a roll call vote or no? Or it's just a preliminary budget?
It's just a budget proposal. We're not,
That's fine.
because it's got to be submitted to the finance committee.
Yeah.
George?
That's all I wanted to have.
Yeah.
Okay.
The motion carries then. Overdose fatality review team finding.
It's
That is,
written materials. It's 11. Yeah. Yeah. 11, yeah, it's the big package. It's yours because it's easy. There you go. You're better. I thought you had it on written. So that's why. Okay. Completely lost the page.
Anyway, for the overdose fatality review, we continue to see trends where recommendations are fitting following the case review that the individual could have benefited from a transitional housing placement or some sort of transitional placement. And sounding like a broken record because it continues to be a trend. It continues to be something that's glaringly obvious to us that there is this huge gap in services, specifically in our area, specifically for females of our area more so than males. Transitional housing is essentially non-existent. So we just wanted to kind of reapproach that again. And then visit the list of opioid remediation uses for the opioid settlement funding. As far as under section E with the expansion of warm handoff programs and recovery services, that the funding can be utilized to provide comprehensive wraparound services to individuals in recovery. That does include housing options, transportation, job placement and training, and also used for childcare. But really just drawing attention that this funding can be used for the development of housing opportunities for transitional housing. Mary, did you have anything else you wanted to?
No, well, yeah, I guess, we've talked about it before, so I won't be a broken record, but many of the people that we serve, and it's becoming more evident every time we review an overdose fatality, is these folks have generational trauma, they have generational substance use, dysfunctional parenting. They haven't learned a lot of the life skills that some youth have the privilege of getting. So we kind of need to start from scratch with these folks and really give them a good supportive environment where they're learning those skills that a lot of kids learn when they're 8, 10, 12. These folks haven't had the opportunity. So that's really what we're envisioning, is a really warm wraparound approach for these people. So they have good support in a small setting. And the reason we're looking at a 1 to 2 bedroom adult family home is for that small setting. So you don't have 8 people together, because, sometimes if one person's slipping and in their recovery, they don't want to necessarily use alone, and they might, encourage other people who are doing good in their recovery journey to join them. And so a smaller setting really would limit that. And I think it would really increase the probability of them having a successful recovery. And we envision these folks to be, skilled in substance abuse, what recovery is, how to really support that. And even after the person moves out, to be a support for those people. So, yeah. So what we would like is, when we have the opportunity to have discussion at a higher county board level, to consider this as one of the funding sources for that settlement money, to support either local adult family home, which is what we really envisioned. But in some cases, it's better for that person to move to another area and not have all of the triggers and the same support system that they're using with, and have a fresh start. So kind of looking at both of those.
Okay.
I think we have a raised hand.
Dan,
Oh, Dan, go ahead.
Yeah, hi. I just want to say, I know the sheriff's department is also looking at using some of this money for treatment of inmates. They're working with Bad River right now to create a program to treat people with Suboxone and make sure that people who are coming in the jail who are addicted or leave the jail not addicted, or at least starting a treatment program. So I think this issue also needs to go to PPLE for discussion, because the sheriff in most counties are using the opiate funds at both HHS and Sheriff's Department, both for immediate needs and long-term needs. So. Also, we're still getting more settlement money in. So.
Yeah, this isn't, we aren't asking for it all. We're just discussing some consideration for it.
Laura has her hand raised.
Laura, go ahead.
I'm just waving. I still think we need to form some, I know you guys have the task force there for recommendations, but I also think we need to pull in, Pat Nemec's got a group that he's got $1 million already that's looking to do the same kind of stuff we're talking about. I think we need to do this as a regional thing too, because if us and Bayfield and some of the close counties and the tribes get together, we can have a really nice opportunity to have a nice treatment center and some of the housing that we're talking about. We pool that money and it's going to be better for the whole region. So as we go through this, I know we need to fill holes with the people that we're serving too, but I'd like to think on a bigger scale to help the whole region because we've all been hit hard with it.
And Bayfield County has expressed interest in our 1 to 2 bed adult family home model, so there would, I think, be buy-in for that.
Yeah, Pat Nemec's been looking for stuff like that too with that group that he's got. He's got a board and he's got some money. So I think we all need to talk yet, but I like the ideas. I mean, you guys are on the right track, so.
Matt?
I just want to ask Liz if you had some ideas, there's some local transitional housing opportunities around here that we can buy into, or is it something we'd have to develop on our own?
I don't know that we really have anything local there. I mean, there's, and that's part of the problem is when we do have people who do go to transitional housing, the waiting list is so long and it's not in our area. They're traveling hours away. And then when they do, you know, when they complete that and then they come back to our area, they don't have the support systems because they're so far away. It's still setting them up for not the greatest outcome.
Any other comments or questions? Do we need a motion to approve this?
Yeah, just to
Adding this
recommend,
wording to the proposal.
yeah. And I guess it would be recommend to with Dan's information, maybe make a motion to recommend collaboration with public property and law enforcement to look at best uses for opioid settlement funds. And don't make me say that again.
I'll make a motion that we consider the use of opiate settlement funds for transitional housing in support of opiate users after treatment.
I second that motion.
Any other comments? There's all those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Public health update.
All right, I don't have to dig around
Before
for
we
this. I have
Before
this
we
one.
move on, Was there additional stuff besides just the agenda item title page that was for, or was it just verbal then?
Under written materials,
So
11A.
in the agenda,
Under written materials,
11A.
Lisa's saying it's 11A.
Mhm.
11A, thank you.
All right, so for a public health update, I just wanted to give a quick update on our parks project. So we have a lovely picture that we were on the paper. So we were able to make a sizable donation to the town of Jacobs for the Marion Park Playground fundraiser, which got them substantially closer. They have just a small amount of money left to obtain the equipment that they were looking for there. And then working with the village of Butternut, the town of Gordon and the city of Mellon, I have some lovely pictures of very, very, very large crates of equipment that have been delivered to both the village of Butternut and the town of Gordon. Their final pieces of equipment should hopefully be delivered. I think Gordon's is actually scheduled within the end of this week or beginning next week. So we will hopefully have playgrounds up and swinging, literally, before the snow flies. I know there was a little bit of a lead time for some of the equipment for Mellon. Their swing set should be on the way, but the larger playground equipment may not actually ship until December. So that one is gonna be a little bit, depends on how much snow we get, or if they can do the installation yet this year, or if that'll get pushed off until the spring. But we do have playgrounds in the works, so very excited about that.
It's awesome.
And then the other big update that we have for public health right now is flu season is here. October 1st is very fast approaching. So we have clinics scheduled in a whole bunch of locations. We have clinics scheduled for all of the school districts within Ashland County that were interested. The first one will be starting on October 3rd. And going all the way throughout into November will be our last clinics for the school districts. We have clinics scheduled for the senior meal sites. We have a drive-in clinic scheduled for here. Schwamigan Clinic was kind enough to offer their boardroom. So towards the end of October, we'll actually be having a walk-in clinic out at the Schwamigan Clinic. So they'll be able to advertise out on their kiosk for us as well. And then we won't be shivering at the end of the month doing another drive-through. So we're very appreciative of that opportunity to partner there. We also have several clinics scheduled for private businesses throughout the county, which is a really nice opportunity because the businesses then are actually, so we're going in and providing the vaccinations for any staff that are interested. And then the businesses are actually paying for those vaccinations as a whole for their employees. So really nice opportunity through that. And then we have a few, other clinics for our staff, the courthouse, highway. Those are all scheduled. And then the other vaccination that is coming up will be the COVID-19 vaccinations. So those are going to look a little bit different at this point in time, just because the previous supply of COVID vaccines were all state and federally funded. And going forward, they've now been privatized. So we will not be providing COVID vaccine in the mass clinic setting that we had previously. We will be part of the Bridge Access Program, which we will have a supply of vaccine to provide for people that are uninsured, underinsured, or they have insurance, but their insurance doesn't cover vaccines. Otherwise, for like even our own staff, unfortunately, we won't be able to vaccinate our own staff. We'll have to refer them either to their provider or to the clinics locally once the vaccine comes out. So that is a minor disadvantage in that, but we're still hoping to try to fill the gaps for those people that don't have insurance or need that extra assistance in locating a vaccine. And then the same for the RSV vaccine. We will not have a supply of that available, but I know the clinics and pharmacies locally have had it or will be having it soon, so we can refer people out to those locations for that. One nice thing is thankfully the composition of the vaccines, they're able to be administered either at the same time or within days or weeks of each other. They don't necessarily have to be spaced out with 28 days in between them. So I think that covers most of the vaccine updates that we have. And then just kind of as an FYI for a future meeting, the state codes for the rec ed camps have been recently updated. So we will be having to update our fee schedule for that. We are in a consortium with Sawyer County, so we will try to work with Sawyer County on adjusting those fees. Previously, the rec ed camps were only classified as one single classification, and they're actually breaking it out into like 6 different categories. So there will be an entire fee schedule for it that we'll have to take a look at and have that approved, but that will be for down the road. It'll be with the next fee schedule, which will be in May, is when that'll go into effect, so.
Yeah,
I'd just like to say that as far as playground equipment, the city is switching out some playground equipment. We have some old stuff that is still quite usable, and if that's of interest, I know we could get you a really good price on it.
Where were you a month ago?
Rich, you have a question?
Yeah, on that COVID, is that the new COVID, the updated one, it's supposed to be
Yeah.
out this week?
Yep, that'll be the new one.
Okay.
So the previous vaccine was a bivalent booster. It had 2 different strains in it. And per the ACIP recommendations, the new one that's coming out it covers the main strain that's been circulating. So we anticipate it's going to be similar to how the flu vaccines are, where it covers the main strains, or what they anticipate will be the dominant strain circulating, and we anticipate that it'll probably switch out every year, similar to how the flu vaccine does.
And all these shots like the flu and the COVID, you have to go to your clinic or whatever to get the shots. And, okay, so. I just wanted-
For COVID and RSV, we're still doing the flu.
Well, okay, so,
Yeah.
and you got those set up to, like, so to schools and stuff?
Yep.
Okay, and how's that being advertised? Cause that's the biggest thing I get is, I never seen it, where's that advertised? So I just wondering.
We have a meeting tomorrow morning, with, Bayfield County, Iron County, several of the school districts, and pretty much all of the clinics in the hospital. So we will be putting out advertising, after that meeting. We're trying to just organize and get all of the clinics together, because then we send out mass advertising for the tri-county area.
Okay, thanks.
Any other questions for Liz?
Liz, did you say you're going to have COVID ones? Or there was part of that I missed because there's some side conversations I'm having a hard time hearing over. But because my seniors are already looking for COVID shots too.
We'll have
They're
COVID for.
They're ready to line up for all the shots.
So the COVID we'll have available will be for those that are uninsured, underinsured, or their insurance doesn't cover vaccines. For
Okay.
those that if they have Medicare, Medicaid, their best option might be to go to the pharmacy or to check in with their doctor. And they don't actually have to schedule a doctor's appointment for it. They can just request a nurse appointment for a vaccine.
Okay. All right, I'll get that out to him.
Anything else? Next item is proposed meeting dates for next year.
And so that is included in your packet. I think it's on the back side of, and I just was talking with Dan this morning, and it was brought to our attention that this will be an election year for the county board. So the April 17th meeting really probably will not be feasible, right? Because people might not be appointed to the board already. So the other dates though would be typical from other years. So we'd be looking at February 21st, June 19th for the public hearing, the September meeting again for the budget, and then November 20th. It falls in between Veterans Day and Thanksgiving, so that's always a concern for hunters and holidayers. So these are the proposed dates, and if we need to add in more, we can certainly do that, but at least start with these if that's amenable to you.
Well, there, some of us don't plan that far ahead.
You said you wouldn't talk about me that way.
So, Terry, did
Do
you
we
say
need
there's
a
a
motion?
different day for that April meeting?
If we could schedule it if needed, but I think we'll wait and see when the appointments are made. Otherwise, we'll kind of have a lame duck session here for the April.
Dan?
Yeah, I just wanted to say the election is April 2nd. And so the new county board would take their oath on April 16th. So
Yeah, it's always. That meeting, our meeting always ends up like the day after.
Yeah.
The reorganizational meeting for the county board, and
Yeah,
a lot of the committee appointments aren't
Are
set then yet.
Right,
Yeah.
yeah.
yeah, and by statute, we have to do it on the 16th, so.
Mhm.
Can't we just push that one meeting back a week? So instead of the 17th, do it on the 24th?
Well, I can have HHS appointments ready because those are, that's an administrator appointed committee. It's just generally the other committees are not done yet.
So if you'd like to do that, we could do that on the 24th. That works for everybody?
It's everybody's
It sounds
thought.
like we could just use the 17th too, from what Dan just said.
Yeah, yeah.
Well, that would be fine.
leave it
Yeah,
as is.
we can leave it at that, and if we need to change it, we can change it
Okay.
later.
Sounds good.
This is Joy. I anticipate a conflict with the November 20th because it's the Wednesday before Thanksgiving. We usually do travel. I don't know if anyone else travels that week.
What did you say, Joy? It's the what?
The Wednesday before Thanksgiving for next year, isn't it?
No, Thanksgiving is on the 28th.
The 28th?
Yeah.
Oh, okay. Then I'd be fine.
Okay.
All right, we'll move on. Written materials. Anybody have any questions about the written materials, or supervisors have any comments they'd like to make?
So, I just wanted to point out, and there isn't necessarily a sheet that goes with this one, but there is, in your written materials, right after Liz's, opioid report, is a list of, all of our, northern region counties. With, of course, us at the top where we belong, but, you'll note on the far right hand column, this is a list of what workers are compensated for being on call. You'll note that we are at $168 a week, and we are well below all of the other counties in our region. So this is more so for informational purposes for you right at this time, but I just wanted to make sure the other thing that's pointed out here is that number has not changed since 1997. I negotiated for the union in that contract year, and that was when that number changed. It has not budged since then. So just want to throw that out there for your consideration.
How many hours a year do you think you get called on?
Oh, man, it varies so much, man. There have been, just looking back on my own career, there have been weeks where I got called out. I think the most was 17 calls in 1 week. And that can be anything from a phone call to you're up all night long. So it's difficult to say. Just depends on circumstances. But the $68 a day is the base. It's basically $1 an hour.
$24.
$24 a day.
So, and for those of you who don't know, there are certain areas where there's no cell service, so you have to be cognizant of that. You have to be within a few minutes of being able to respond when law enforcement requests us. So it really does hinder what people can do in their free time when they are on call. And they rotate on call between all the workers, so it's generally about they'll take a week from a Tuesday afternoon to the next Tuesday morning, about once every 8 weeks.
Yeah.
Actually 6 or 7.
It's 6 to 7.
When you're
6 or
47.
7.
Yeah. And of course, that puts me on call 24/7, 365, but I'm already getting paid for that.
The big bucks.
Yeah, actually, Chrissy Hagewell from, the regional office, our, area or assistant area administrator. Reached out to all the counties and put this chart together. Because, I mean, other counties were like wanting to go back in and get an increase to their on-call pay, and I was like, wow. So,
Yeah, so 25 years it's been stagnant, so
Yeah.
this is, like Jerry said, just informational at this point.
Any other comments or questions on the written materials?
I have some comments on the written materials. If there's some of these written materials that pertain to some of the agenda items, it would be nice that, like Liz's recommendations on the opioid part, having that underneath with the agenda item sheet. So that way it's easier to navigate. Otherwise I'm scrolling through all these different sheets on here if I'm online, and if there's people from the public that are looking at the packets, it's much easier to understand if that stuff is with the agenda item.
Yep, we can make that happen, Laura.
Thank you.
Anything else? Board member updates and suggested agenda items. George.
So I think this might be worth talking about. The Counties Association had its annual meeting this week with all the counties. And in the session on public health, there was considerable discussion about the damage to the reputation of public health due to the disinformation during the first 2 years of COVID. And I don't know how badly or not badly it's affected us up here. I'm kind of wondering where we stand in our sense of our public relations and the public perception. Because downstate, they were really complaining about it.
I can tell you one thing. I think we have an extremely supportive board, not just our Health and Human Services, but the full board in specifically. You know, Liz can tell you horror stories about threats and, you know, people just leaving the field left and right because they're the misperceptions, the misinformation, all of that has affected public health. I personally just got an email from Congressman Tiffany asking about my thoughts on this new proposal that he's putting out there for making it, what was it, Liz? Mask?
Anti-mask. I don't
Like
remember
making-
what he called it.
Banning.
Yeah.
Mask mandates,
Yeah.
regardless of anything. So yeah, it's certainly affected public health and the perception of public health. I think he said in his email that there's no evidence or no science to support that masks are effective, which we know is not correct. They are effective.
But then there was another topic that I couldn't get the presenters to get to in their time frame, which I don't understand fully the level of support or backup in the relationship between the State Department of Public Health and our local county health officers. You know, there's an awful lot on the shoulder of our local county health officers, a lot. And I don't know to what extent the State Department of Health is helpful or not. Could you enlighten us, please?
Can we turn the recording off? No, it really, a lot of it depends, situationally for what the instance is. A lot of our programs, are outlined and requirements are specifically listed per state statute. Like even my qualifications that I have to meet to be eligible to be considered a health officer are outlined in state statute. And then that goes into what level our health department can be considered per our 140 review of what requirements are we meeting, what program requirements do we have, and are we meeting, and the level of service that we're providing for how we are then qualified as a level 1, 2, or 3 health department. So right now we are qualified as a level 2 health department based on what my qualifications are. And that's outlined in state statute. So You know, and I'll just, communicable disease for an example, we are required by the state to conduct communicable disease investigation, follow up on outbreaks and, you know, suspect cases and things like that. But our communicable disease grant, as far as state funding, we got $2,467, something to that effect. So that is our assistance as far as state funding for that specific program requirement that we are mandated, that we have to do these investigations. You know, obviously COVID kind of put a whole new awareness as far as the communicable disease, for the different things that, you know, we follow up on. But, you know, for an example, like back in June, we were following up on a suspect case of tuberculosis. We don't have any funding at that point in time left from our $2,000 for me to spend my time running lab samples back and forth from the person's house to the hospital to get these samples and ship them out and everything like that. So then that goes to our levy that we have to, you know, pay for that out of our base funds because it's a required service. We have to do it. It's outlined in statute, but we don't have any grant funding left to pay for it.
Well, I was more or less wondering whether their centralized expertise was of any utility for us. In other words, we've been told what we have to do, but do we ever get any assistance in figuring out how to do it? Is there any centralized expertise that is actually of any utility to us?
I will say that our regional person
Yes.
is actually very helpful. Our regional office is based out of Rhinelander. And there's 3 main contacts that we go through for public health out of the regional office, and they're fantastic people. I can call them after hours and they will point me in the right direction for, you know, who I need to call if something's going on. So we do have support specifically at the regional level. There have been some instances where I've gotten calls from, you know, and I can think of like one instance where I received a phone call from, he's retired, but it was Chuck Warzeka, and that was early on in COVID when they were looking at kind of trying to figure out new CMS guidance, working with the state in the process of reopening nursing homes and getting people in for visitations and things like that in nursing homes. And I was actually invited to be on that task force to work within that group. So they do reach out. Not often in necessarily rural areas, but in some instances, they do reach out specifically if we've been involved with certain things or if state contacts know that we have specific interests in certain areas or areas of expertise, they will contact and reach out so we can get a very active voice in how things happen sometimes. So.
Okay, thank you. I did brag a little bit that we've been able to hammer out a disease ordinance, which it sounded like a lot of counties that was way out of reach because of the pushback in their locations.
Did you see what happened in Wausau?
No, I did not. What?
If you just Google the news article for communicable disease resolution in Marathon County, it just happened on, I remember it was September 6th or September 8th. There were approximately 200 people that had showed up for the board meeting. A number of them were self-described anti-mask, anti-vaxxers, essentially anti-COVID. And there was no decorum. It was whoever yelled the loudest and the longest was who got to go next. And there was no limit on public speaking. And there was a lot of very inappropriate things that were yelled out, and the health officer was actually escorted from the premises for her safety.
Wow.
So,
Wow. We're in a good place here.
Yeah.
I got one question.
Rich?
I just like to know how many active COVID cases we have right now in Ashland County or Bayfield County.
I have no good answer for you because the majority of our tests are conducted via home test and they're not reported.
They're not reported. So we have no idea.
I have no real good
Okay.
number.
You have to get a hand.
Dan?
Yeah, while you're on the subject of COVID, and I just wanted to let you guys know that the federal government's gonna be making home test kits available again for free by mail, starting on Monday.
Oh,
Wow.
I don't know that.
So you can go to covidtest.gov and you can get free test kits mailed to you. So if you want to, Rich, if you want to tell everyone where you are about that.
George,
Just on this question of surveillance, do we have any of this ability through our sanitation system to have a general surveillance, and is that telling us anything?
Yeah, they're still sending us those reports.
Yep, they still do the wastewater management. We receive weekly reports on that. We've had some. You can pretty much map it out anytime there's any major holiday or large gathering of people. Like I'm willing to bet that there's gonna be a spike in the sanitation report after Apple Fest weekend because there's a large group of people. So that does kind of give a general idea for the activity that's going on and, understand that when I say there's been a spike in case activity, these spikes that we're having now are, this big of spikes compared to the spikes that we used to have were this big of spikes. So we are in a low to moderately low level consistently. We haven't really fall down and stayed in the very low levels. We kind of keep on bouncing back and forth. So it is an underlying thing that is ongoing, but we don't have an accurate number of how many cases there actually are because of the home test. And also thankfully, a lot of the cases have been mild. So then people don't actually even test.
thank you. Laura?
I guess for the next meeting, I'd like to have some more either discussion or follow-up on the on-call employment wages for social services. One of the things that we've had over the time that I've been here is some major turnover, and that costs a lot of money. And we've lost some really awesome people. We've gained some really awesome people. However, my concern is at 25 years and there's been no change for this. And, I've been a person who's been on call, not for here, but I really think we need to look at that as a county and think about the long-term impact that can and maybe has already had on our workers here. It's pretty tough to be in the middle of something and then have to transition into potentially some pretty awful scenarios, and the mental health that comes from all of those things, secondary trauma, and which I can explain as a school teacher. And so I really feel like this board should have a discussion about that, and then we could look at potentially sending something on to the finance committee, and so there's a discussion at the board, the county board level. When you look at the numbers of children in alternative placement, and some of the situations that our social workers are put in, as a former teacher who worked with students who are at risk, I know what some of those calls were, and that children were split up in the middle of the night, and the scenario was really awful. And so I just hats off to your team, because that's 6 to 7 weeks and you're on call. That's a lot. You can't really leave the area, and that has a major impact on your life and you already have a very stressful job and a dedication to this county, to this region. And I know that the budget's tight. I like to save my money too, and I know that we have a community where there's high poverty. And but wow, this is totally unacceptable from my perspective, totally unacceptable. And we need to have a discussion about this.
Thanks, Laura. George?
It just came to mind that there was another point made at the Counties Association, was that in public health, we just don't get credit when things go right. And I haven't heard anything wrong about our beaches this summer. I was wondering if that was accurate and are we doing it right?
We had very few beach closures this summer.
Yeah.
In part due to the fact that we didn't have a lot of significant rainstorms. And, we also have to give the city a lot of credit because they have their goose removal crew. That they go and they shoo the geese away from the areas where they like to congregate, because that's a large contributing factor to it. And I only heard very limited reports of swimmer's itch, but that also happened to coincide when one of the beaches was closed and there was a significant goose population at that point in time.
It's an example. We don't get credit when things go right. You did a good job.
Well, and also the value of the prevention. It's always hard to figure out how you put that in to a budget that, and my numbers may be off, I don't know, but a dollar up front in prevention saves $7, for youth through adulthood, through the just way too many people that I know who have passed on from overdoses. And from my perspective, we've got to continue to do the hard work that you all have been doing, and point out those things, that the good works that are happening here. I think we do need to, toot our own horn or something like that and point these things out, how much it saves. And I think of how recently the school has really tried to push information out on the positive things that they're doing and the impact that that's having. And, is that something that we can do? Not that you need one more thing to do. However, then when people hear about the increases in taxes, then it's like, oh, well, actually, it's actually saving us in the long run, and it maybe is preventing one of my children or one of my family members or my neighbor from overdosing, because we're all touched by these things. Although I don't think I don't think that's talked about near enough either. And so because there's not an awareness of all the overdoses that happen, and the people who have been left alone to die because nobody wanted to be there to get busted. There's just some fundamental things here that I really feel very strongly about, and we've got to start tackling some of these things, as a region. And I know that those are hard, and I know that there's already, you're stretched, but my gosh.
Am I allowed to say something?
Sure, go ahead.
All right, I just gotta further toot Liz's horn. She was actually with a group of folks from MMC and other area agencies to promote the International Overdose Awareness Day.
Oh, wow.
We all donned our purple shirts with a big heart on it. It says "End Overdose" right on it. And we ended up having a group photo up in front of the building here, and there was a virtual 5K. And Liz was a big part of getting that done, so.
Any-
I was just gonna say, we do have Narcan boxes in the community. I actually restocked one of them yesterday. I made a delivery to restock because people have been taking the Narcan emergency kits from them.
Okay.
Excellent,
So-
excellent.
Anything else?
I'll make a motion to adjourn.
Second.
Motion made and seconded, all in favor?
Aye.
Aye.
Bye.
Thank you, everybody.